Hello guys, welcome to the Cardiology series of AMC 1. The first condition that we are going to discuss here is ASD, atrial septal defect. So as the name indicates, there is a defect between the atrial septum, which is between the right atrium and left atrium of the heart. To be simple, there is a hole between right atrium and left atrium. Imagine this is the hole. Okay, so now the blood from the left atrium will move to the right atrium. So the first point that you need to remember in this condition is there is a left to right shunt. Don't interchange it from right to left. It's always left to right shunt. So as I told you now, the blood from the left atrium is shifted to the right atrium. So obviously due to gravity it will fall down from right atrium to right ventricle. In right ventricle we have pulmonary artery. So this pulmonary artery will open due to the increased blood flow into the right ventricle. The pressure will be more and the pressure opens this valve or pushes this valve so that the blood will flow into the pulmonary artery. Pulmonary artery ends up with two lungs in both sides, right? So the pressure over the pulmonary artery increases, same time the lungs also increases, which leads to increased pulmonary arterial hypertension, increased PAH. So in atrial septal defect, you will be having increased pulmonary pressure, which is known as increased pulmonary arterial hypertension. So in this condition, you can also see increased pulmonary arterial hypertension. So you need to remember this also. So the first point is covered, left to atrial right shunt and increased pulmonary hypertension. And the next thing that I would like to tell you is that here in this condition we can hear ejection systolic murmur. You need to remember that. Ejection systolic murmur is heard. It's actually felt in the area of lungs, pulmonary area. So the ejection systolic murmur is heard. This murmur is heard because of rush of the blood due to the pressure. As the pressure is increased, we can hear ejection systolic murmur in the pulmonary area. So ejection systolic murmur is heard in the pulmonary area. Next thing, fixed splitting of S2 and loud P2. So this is an important factor which I need to explain more on. So let me tell you. We have two heart sounds. As far as we all know, S1 and S2 is normal heart sounds, right? So S1 is the closure of atrioventricular valve. Okay, closure of atrioventricular valve. As we know, atrioventricular valve is nothing but tricuspid valve and mitral valve. So let's keep S1 is equal to T1 plus M1, which is nothing but S1 sound is due to the closure of tricuspid valve and mitral valve. Same time, let's go into the S2. So S2 is closure of semilunar valve. The semilunar valve is nothing but aortic valve and pulmonary valve. If you don't know where is these valves, please refer to an image. Just check in Google for these images of these valves. So understanding is the key. So you need to understand where is it. So we can make it like S2 is equal to S2 heart sound is equal to closure of A2 plus P2. Okay. So aortic valve and pulmonary valve closes togetherly to give a sound of S2. Tricuspid valve and mitral valve closes togetherly to give a sound of S1. So let's imagine we have two sounds, S1 and S2, right? So in this particular condition, S2, the second heart sound is said to be as fixed. Okay, but you can hear a loud P2 sound. So here the S1 is normal, S2 is fixed with a loud P2. This is the third point that you need to remember. Okay, so this is all about atrial septal defect. So now let's move into a case. Okay, imagine 60 years old, okay, male came into your clinic with shortness of breath, okay, and on auscultation you heard ejection systolic murmur in the pulmonary area. In the pulmonary, ejection systolic murmur in the pulmonary area. Okay, now you can also hear fixed splitting with loud P2. Now you will be having some option. What are the conditions? One will be ASD. So now I have discussed you all the key findings. Okay, SOB, ejection systolic murmur, fixed splitting with loud P2. So now the thing is, what I would like to emphasize here is 60 years old male. Okay, so as we know, ASD is a congenital heart disease. Okay, it's a congenital heart disease and it is mostly missed to diagnose during childhood. So it's also diagnosed in adulthood. So here in this case, remember that ASD is congenital heart disease, but it is also diagnosed during the adulthood. Second thing we have here is SOB. Why? Whenever you study your blue book also, you need to study in this way. You need to question yourself why. So SOB, why? Patient is having increased pulmonary arterial hypertension, as I told you. Okay, so the blood supply and blood pressure towards the lungs is increased. The patient will be having pulmonary congestion. Okay, congestion. So pulmonary congestion, if we go beyond that, it further leads to pulmonary edema. There are lot of findings that you could find for a pulmonary edema in the chest X-ray. So this congestion, increased blood supply or congestion causes shortness of breath in the patient. And next thing, auscultation. Auscultatory finding, I told you there is ejection systolic murmur that is specific to the pulmonary area. Ejection systolic murmurs is actually heard due to rush of blood. As the blood is going in high pressure, so that pressured sound is nothing but murmur. Okay, that is heard in pulmonary area because the patient is having pulmonary hypertension, because increased blood supply towards pulmonary side, because we have a hole between right atrium and left ventricle, left atrium, right? This hole, as I explained starting, the blood moves towards right ventricle, from there into the pulmonary vessels. So the pressure is more felt in the pulmonary vessels. Hence the patient will be having the murmur heard in the pulmonary area. And the next thing that I have discussed you was fixed splitting, loud P2. So this is clearly explained regarding the sound. And here ends our first topic of ASD. This would help you in diagnosing the clinical scenario and also the clinical cases with the signs and symptoms. These are the main topics or main points that you need to remember about ASD. So any doubts regarding ASD, you can put it into the comment section and I am ready to help you out with. Thank you.